not just a symptom. And when there's a block to circulation in the body, then that can lead to pain or a breakdown in any system in the body, including the organ system. A person has to go after those things looking at the circulatory system, the organ system. So again, this is material from the front of the book that talks about how the body is, rigged and how things work and so on. So acupuncture, we talked about, it's a 3,500-year-old healing science based on finding the blocks of circulation in the body and using specific techniques to remove those blocks. It's a procedure adapted from Chinese medical practice where specific points are stimulated to increase blood and energy flow, improving organ function and relieving pain and illness. There's no side effects. It's a one-time use acupuncture needle. Do we have any? Do we have an acupuncture needle in the box? Yeah, if you can check where it's been made. I'm actually quite needle sensitive. None of my family can believe I'm an acupuncturist. My kid would attest to this. It's kind of like a family joke. My little sister Eva was the only sibling to be born in a hospital, and the doctor, was an osteopath. So we were in the hospital operating room, and the delivery was at the delivery room, and it was happening, and I passed out. Missed the entire thing. Nobody can believe that I'm an acupuncturist in my family. It's kind of a running joke. Anyway, gives you an idea. So typical treatment, you're lying down either on your back or your stomach. Anywhere between 4 and 25 points might be used. It's generally very relaxing. A lot of people sleep when they get their treatment. Now, talking about the diagnostics that I was mentioning earlier. So basically, we look at the condition of these systems, circulatory, organ system. There's 2 different circulatory systems that we're focused on. So there's a total of 3 different things we're looking at. We check the tongue, and we also look at the pulse. So this is pretty interesting. Again, for people who are interested in going a little deeper, this is touched on a little bit in the book, and I was told by a patient who's in the printing industry recently that we have to add a section in the book about this totally, but I'll give you the inside scoop since he came tonight. So basically, the thing is let's picture people in China 4,000 years ago, 2,000 years ago. They're trying to figure out, why do I have this specific symptom? And they're trying to understand, okay, my body's breaking down. What is the reason for that? They didn't have MRIs. They didn't have X-rays. So they started to look deeply into what is it that causes people's conditions, and they started to go to the underlying issue. All right, so we'll pass this around. Maybe now once this is open, this is not sterile. This is a sealed package that when we place it into a person, after opening it, we take it out, we have it incinerated. So this is now unsterile. So she's going to open this up and we'll just pass it around. The FDA, believe it or not, considers this a surgical device because they have no idea what to do with us. But we're going to pass it around and give you an idea of what an acupuncture needle looks like. Anyway, so if you look at the organ system, they were trying to figure out, well, what's going on internally, and what they established, which is really interesting, is that there's a pathway that travels from the internal organ out to positions on the radial artery. Anybody here in healthcare? Raise your hand if you're in the healthcare field. Okay. All right. So the radial artery is the artery that runs below the thumb, and obviously is carrying blood from the heart down on both sides. And there are positions that they discovered on the radial artery that you can feel, and you'll find the exact state of health and function of the organ. So, for example, if somebody came in, like in our initial visit, the acupuncturist really find out nothing about the symptoms before we check the pulses because the pulses are so clear to us. As a matter of fact, we'd rather not know about symptoms and treat the pulses only because that would give us the most straight shot to the underlying cause. However, people have their conditions, so we want to help out with that. But the first thing we do as acupuncturists, without knowing anything about the condition, is feel the pulses. And then we're clearly understanding what's going on. So a person comes in, for example, let's say there was a case study, let's say what we were talking about, the liver and acid reflux. So there's a position on the left side, in the middle position that the Chinese discovered, that corresponds to the liver. So when you put your fingers, what's known as palpate, this particular position on the wrist, there is an actual very specific thing that we're feeling for what the liver is doing. For example, if it felt like a guitar string in that one specific position, it would show something happening with the liver. Or on the other side, in the digestive, there's a pulse in the middle that shows the digestive function. If that was feeling like a guitar string, what's known as wiry, that shows that it is the liver that's attacking the digestive system. And then the person comes in, they say, well, I have acid reflux, it seems so weird, they've got me on, Acifex or, one of these other medications to suppress the acid. When in actual fact, it might not be too much acid, it could be that the liver is attacking the stomach. The valve is not properly opening and closing when it should, and acid is flowing upwards rather than downwards. See, the stomach has many functions, which again, you'll read in the first section of the book, Nancy, my dear, this is awesome. Functions of the stomach. One of the things the stomach is supposed to do is accept food that goes then down into the digestive system, right? Makes sense. This is the simple logics of the body. If something's flowing up, it's actually called, like a child, myself as a teenager, rebellious function of the stomach. In other words, it's rebelling upward rather than traveling downward. Does that all make sense? Raise your hand if it needs clarity or anything. So we check the pulse in a particular position, and it shows us, in this person's case, the reason they have acid reflux is because the liver is attacking the digestive system, causing the stomach not to behave, and things an unruly teenager. My own little inside joke, right, kid?
Is that what causes bloating? You basically saying to make your stomach go up and blow up?
Well, there's many causes of acid reflux, but when we're checking these particular pulse positions, we're looking to see the state of health and function of the organ. And if we were to feel, you can't really read this because it didn't blow up very well. Incidentally, this is a drawing. It was a woman named Anna who's at the Rhode Island Institute of Design. Do you remember Anna? Years ago? So she drew these hands. I mean, amazing, right? Anyway, stomach and spleen. So we look for stomach and spleen function in this particular position. So what was the name?
Angel.
Angel. Oh, Angel.
Yeah. You remember me?
Yeah, that's great. I was going to have you. It took me a little registering time there. Anyway, so let's say that we felt that particular position and the person didn't tell us anything about the acid reflux. Ideally, we would catch it. We'd say, okay, your liver's attacking your digestive system, and I assume that something's happening, like you're having acid reflux, or you're having irregularity, or something like that, because your liver's freaking out on your digestive system. And the person, in most cases, says, oh yeah, that's happening. Or 2 days later, they come back and they go, I said no, but you know what? It is kind of weird. I only go to the bathroom once every 2 days. But it seemed normal to me until you mentioned it. And I'm like 70. People think their symptoms are normal, but it's not really normal to have those kinds of things happen. Anyway, so it gives you a bit of an idea. Does that clarify it?
Yeah.
Awesome. Okay, good. Yeah.
So like being out of medication for a certain thing doesn't interfere with your diagnosis?
Interesting question. I can credit this to Lindsay Tennell, who's one of my mentors. And I was confused by that. He said, I'll tell you what, their lifestyle, no matter what is in their lifestyle, will cause the diagnosis to magnify. So he said, you can almost tell diagnoses from people when you're checking the pulses, like if they're stuck in traffic a lot, like someone who drives in LA, or from a quantum walk or something like that. It's pretty interesting. Long drive stuck in I-94, you can see because things stagnate and it shows up. If someone's taking a medication, it changes the function of the organ. We feel that. And then, okay, what now? And then that becomes part of the diagnosis. Medicine and with others, heat and toxicity. Oh, well, I've been on this medication for 15 years. The liver and kidneys haven't been able to get it out. Yeah. Answer? Awesome. Okay, keep going backwards. Sorry about that. All right, you ready for Jeopardy?
Of course.
It is Oriental Medicine Month. Today being the day, that's the actual set-aside day by the National Certification Board. So we're going to have some fun with this. Can I use your book? Okay, good. So everybody knows Jeopardy, right? So you have to answer correctly. And if you answer correctly, you get free stuff. And, all right. So here we go. This is like digging into the book a little bit here. So now you have to hit the button, and then you have to answer in what way?
By question.
Bingo. Okay, good. So, this organ has 600 functions that is performing as you are sitting here right now. And one of those is to purify the blood. Yes, Nancy. What is the liver? Okay, round of applause for Nancy. Okay. So these are hawthorn flakes, which are great for cholesterol and settling the stomach and good for hypertension, or almonds.
I'll try them up.
There you go. Very good.